Hey, what's up, everybody? It's Kenny Lamons here with Medicare Millennials. I've got Ethan on the line with me. He is actually down in Texas right now. So we wanted to hop on and talk about the ending of OEP, what we're going to do for the next few months, as well as what to do to look forward for AEP. So what's going on, Ethan?
What's up? Glad to be back, especially glad to be back in a little bit warmer state.
Yes, I am ready for we went out on the boat this weekend, thankfully, and it is good to be back in warmer weather. So
yeah, spoke with the propane people today and they said it was 22 degrees down up there in Michigan right now. So the boat sure was nice on the weekend.
Well, I'm not envious. So, all right, man, let's jump right into it because this stuff, we end up talking way longer than we mean to. But OEP is over, okay, which means that wasn't something we were marketing to begin with, but all the people that we ran into that were wanting to make a change or could be in a better spot, we really didn't have to think too hard about it. As long as they had any kind of Medicare Advantage plan already, then they were able to use that one-time change from January to March and move, either back to their old plan that was better for them or into a new plan, right? So it's pretty wide open January to March when you meet with people that have a Medicare Advantage plan already. But when that time frame ends, everything kind of tightens up a little bit, right?
Right.
So I guess just for starters, how did your OEP go? And now that it's over, how are you going to continue to write business until AEP?
Yeah, I mean, great question. OEP went well. I think one thing people forget is not only do we have the opportunity and chance to help somebody into a better plan during this election, we also have our clients that are still getting picked. I still got phone calls saying, Ethan, when the phone call is going to stop? And I can comfortably, hopefully, say that it would be done at the end of March. So OEP as a whole, it was incredible. We've got to help out a lot of people. My goal was just a little bit lower than normal, seeing that we're doing a little bit more than just producing these days. So I've hit that goal, and I'm excited to continue writing business even outside of OEP.
So how you can do that? Because we don't have the FEMA disaster SEP statewide in Texas like we did last year. We don't have the FEMA COVID disaster SEP like we did a couple of years ago. So what are you going to do? How are you going to continue to write business?
I'm probably going to regret saying this on air, but I actually spoke with our Humana rep the other day, and they said we do have the COVID SEP still, which is weird because it depends on who you ask with different carriers. So let's just scratch that I even said that. Guys, this is the time to know your special election period. So, I mean, Kenny and I have been hounding you on that for 2 years now. And if you haven't done it yet, you need to, because business does not stop after AEP and OEP. In fact, I think when we got into this business, Kenny, OEP wasn't even around, or it was brand new and nobody knew about it. So guys, this is the best time to know and understand and utilize those other special election periods. So here in the DFW market, as well as the Michigan market that I was working at, we had a 5-star plan. I think there's a lot of confusion around 5-star. Just because there is a 5-star plan does not mean that plan is the best for the client. I mean, I'm sure you ran into that, Kenny, where you're like, dang, I could utilize that special election period, but whether it would increase my drug cost or any sort of copays or anything like that, that may not be the very best for the client. So we're going to have 5-star. We're going to have LIS, both maintaining and losing and receiving, which goes hand in hand with dual.
Will you explain that one? I think people get what 5-star is, which is just if CMS deems or rates a plan 5 stars, then Medicare beneficiaries can elect to move to that 5-star plan once a year. They can use this election once per year, regardless. If they have original Medicare with the supplement, maybe they have original Medicare only with a drug plan, maybe they already have an MA plan. If this 5-star plan fits better for them, they can make use of it year round, like, well,
And it's
one
just
time
once.
any
Yeah.
time of the year,
Yeah.
right?
Bingo.
So I
Bingo.
think most people are familiar with that. But if it's not the right fit, you brought up LIS/extra help. So kind of just real briefly overview of how that one works.
Well, for the beginners, LIS is low income subsidy. It's also known as extra help with prescription drugs. If you go to Medicare.gov and you just type in the words extra help, you can do some research on that yourself. But I mean, Kenny, I don't know about you, but how many people do we sit with or visit with or help out that have LIS already, and more importantly, who could probably get qualified for LIS? I mean, how many people do you see with that? And I'll kind of explain what it is and how it helps. But I mean, how many people do you see that currently have LIS? And does that mean Medicaid?
No, yeah. So extra help LIS is different than Medicaid. Okay. So I'm not going to go into the weeds, but
It was confusing.
generally speaking, extra help is geared towards helping people with their prescription drug costs. It can lower the premiums related to drug plans, and it can help cap the copays that they're on the hook for their prescription drugs. Okay. And you can have extra help, but not qualify for the state Medicaid program. So you can kind of think of it as it's going to be more for lower income, but not necessarily super low income, right?
Right.
So somebody might make, in my state at least, a husband and a wife may make $2,400 a month, for instance, and still qualify for some extra help, but they don't qualify maybe for Medicaid.
Right.
So when I run into that, if they already had extra help, they have an election once per quarter to go ahead and move from one plan to another if it's good for them. Or if I meet them and I look at their income, I can just pull my iPad out and say, hey, let's run through this application for extra help. Plug it in on the Social Security website. They'll type all their information in and submit it. And 2 weeks later, usually they'll have a decision. Hey, you do qualify for extra help with your prescriptions. So now I'm the hero that I introduced them to that program, but it also just created a special election period to where they can now move from one plan to another if that's right for them. So that's kind of it.
And guys, that's huge for a lot of people. If you run into somebody that has an inhaler, like with United Healthcare and the DFW market, that'd be what, $47 copay, a lot of insulins, things like that. I mean, you're taking, let's just say $47, and you're capping that drug at, this year, I believe it's $9.85. So like Kenny had mentioned, you are now the hero, and you get to find them a better plan in the process. So you get to help them out as well as help yourselves out. Kenny, you made one error real fast. You did say that, well, at least you didn't make an error. You just didn't go all the way in. If they already have LIS, you can only use the LIS maintaining special election period for the first 3 quarters of the year.
Right.
The only time you can use in Q4 is if they gain or lose that status.
Yep. Good point. And that's also where I'm just going to reiterate, anybody that's watching this video, like, don't come. I am not the end all be all source for these SEPs. I do my best to keep up with them. You really need to do your own research. Go to Medicare.gov, SSA.gov, educate yourself on the exact verbiage of these SEPs, talk to your carrier reps. Like, I love to give you guys like the general ways that we're able to write business, but I don't want y'all to just take me only at my word on this stuff. Do some research on your own so you understand those programs, because what we just discussed about it isn't everything about it. Like, there's little nuances, there's different levels of LIS. We just don't have time to teach everybody on YouTube about the little bitty nuances, but in general, in a nutshell, it's a great way to write business outside of the regular enrollment periods for folks that qualify for some low income subsidy. So
absolutely. And again, if you get somebody on LIS and save them a tremendous amount on their drugs, chances are that's a pretty loyal client moving forward.
So one more point on that. Obviously, you can run into the people that qualify for extra help or LIS or even Medicaid, because kind of the same idea applies to Medicaid, right? Just with any type of lead, occasionally you might run into it. But the direct mail lead piece that Ethan and I began with when we got started in Medicare Advantage, and what we encourage new agents to get started with, is geared towards lower income. So it's going to, not always, but most people you visit, if you're using this type of direct mail lead piece, is going to put you in the homes of people that qualify for some level of this extra help.
Yeah.
So that's really great. But if you're working other lead sources, let's say you're part-time in this and all you do is like some local marketing at your senior center or through your church, etc. Or let's say that you buy T65 leads. That's not a good example because you're going to have an election period if they're turning 65. But let's just say you do not buy a low income lead, or specifically, what other SEPs might be available out there for people that you're meeting?
Well, one in particular, we already talked about LIS and 5-star. One that I just used this morning that we had talked about on a case is the chronic special election period. And I believe there's a little bit of confusion in that one, because I think the confusion starts with me. And I've asked you this before, Kenny, when using a chronic special election period, just to verify, we do have to be putting them in a chronic plan. Is that correct?
That's right.
Okay.
So that can be confusing because you might find out about this chronic special needs plan and they ask, do you have a heart condition, or do you use at least one medication for diabetes, whatever their criteria is to be on that plan. That's so. And then I've had people say they kind of think that applies to anybody for any plan, and it doesn't, right? So
Right.
Step one is whatever zip codes you market to, whatever counties you market to. And for me, that's pretty local. So this is easy for me to keep up with. First thing you do is just go identify on Medicare.gov or Sunfire, whatever you use, what chronic special needs plans are available in those areas. Okay. Then you need to reach out to the carrier directly about their plan and ask what the qualifications are. And then you need to understand that just because Humana has a special chronic special needs plan in your county that you can make use of, doesn't mean that if they have one of those chronic conditions, they can get on the regular Humana plan or another carrier plan. So,
right. Yeah, I've certainly made that error. And for something we talked about last week, Kenny, I'm going to bring up, I think is an excellent point. When you write a chronic plan, you really need to keep up with it, because the doctor that you put on that chronic plan's application, the carrier will reach out to that doctor to verify that they have diabetes or whatever it may be. And if they can't get a hold of that doctor or get that doctor to let that carrier know that they do have that condition, they can use that plan for a month or two. I don't know how long it is, Kenny. You might remind me. 63 days. But if they don't get that verification, they get cut off, right? And they have to. So you have to stay on top of that. And I'm not necessarily saying you have to sit there and like hound the doctor or anything like that. But you need to let the client know, hey, we're putting you this in this plan. It's a very good plan. Here's the reason we're doing it, but it's going to take a little legwork from your doctor. So if I get an email or you get a letter from whatever carrier saying we still need verification, I need to know that, because like that when we talked about, you saw that I lost that client in November of last year and I didn't keep up with it. It was because she didn't get that verification from her doctor. So a really good point there. Really good lesson.
Let me here's just been my experience. Again, I don't remember the exact dates, but here's generally how it works. If you put somebody on a plan for April 1st, right? So you met somebody in March, a referral or something, and they had diabetes, and Humana in your county had a chronic diabetes plan that fit great for them. So you sign them up for that plan and you use the chronic SEP. Okay. They're going to take your word for it on that application, and they're going to put them on that chronic plan for April 1st. But then if within April, January, February, March, April and May, they have that 2-month period for the carrier to verify with the provider that you put down. And if it doesn't happen within that time frame, your customer will start getting letters saying, hey, you're going to lose this plan. You're going to be kicked off this plan if we can't get in touch with your provider to get this form filled out or get this verified. If that happens, let's just say the customer thought that they had that chronic condition, but it was the carrier talks to the provider and they're like, no, they don't actually have XYZ condition. They're going to be booted off the plan, but that gives them an SEP again to go ahead and get back on a regular plan. So you got to keep up with them just in case whether they were dishonest with you or whether they were just confused, or maybe their provider just won't respond to the carrier. They're not just up a creek. As long as you're keeping up with your client, if they can't get that verified after that 2-month period, you can then have them put back onto another just regular Medicare Advantage plan in that scenario. So
yeah, super important to keep up with. And that's as easy as setting a reminder on your phone.
There's obviously going to be some different things you can do outside of those SEPs. Like you may run into people that are moving, and, we just got out of prison. Ethan's used that before. Met a client that was recently incarcerated, coming out of a nursing home. Like there's some real niche SEPs that you're not probably going to build your marketing plan around, but that are out there. But I just want to touch on the other big one that you can use year round, and that's turning 65, right?
Yeah.
So that's anybody they're going to be brand new. That's their first time enrolling in Medicare. And obviously they can do, whenever they turn 65, they're wide open to pick what plan they want. One of the reasons that we haven't in the past focused on that, why is that, Ethan? Because most people that are interested in Medicare, when they learn about T65 market, they go, why wouldn't I focus on that? No underwriting,
all the time.
Higher commission in some scenarios. Like you're their first, everything seems perfect with the T65. So why didn't me and you spend our first 2.5, 3 years just going after T65s?
Several reasons. It's heavily targeted by all the insurance companies. So, you're going up against companies that have millions and millions of dollars in their pockets to use towards advertising because of the statistic that comes with T65. And that means it's very expensive to market towards them. And for you to be able to create something that stands out, everybody's heard of Humana, everybody's heard of United Healthcare, and they have a pretty little postcard that goes out and says, $0 plans, choose me. And then you got a little postcard from Ethan Glidewell in Fort Worth, Texas. That's really hard to compete against. But it sounds like you're having quite a bit of success there, Kenny, which we'll talk about later.
Well, yeah. So just to expand on that, I'm not discouraging anybody from focusing on T65s. Just be prepared to spend a higher amount of money per customer to acquire that T65 customer. So if you think you're going to send out 1,000 pieces of mail and you're going to get, 2% of those to convert, you're not, because there are a ton of other agencies, agents, and companies, the insurance companies themselves targeting them. So again, it's a great market. You can do seminar marketing that's geared towards people that are turning 65. You can buy leads. You can do all kinds of different things, but it's more expensive and more competitive. So if you're a brand new agent, that may not be the best way to just get the momentum going, right? That's why we like starting out with direct mailers that are a little more generic, geared towards lower income, so we can get more at bats, get more practice presenting these products and working with these customers, and just a little bit more speed in the number of people we can see early on is why we don't, I'm doing more and more T65, but I also have more and more expendable income to put into that. And quite frankly, more and more time to go cultivate some local relationships to drive T65 business as well. So
something that I've done in the past that's really worked out, and I hope somebody takes note of this, is when you get a T65 referral and they worked for a larger company that doesn't offer any sort of benefits outside of retirement, health benefits in particular. And let's say they're past 65 and you have to get a letter of credible coverage from that company. So that client is going to have to reach out to the HR department. That's an excellent opportunity for you to get in there right there and say, hey, look, for every single person that's retiring, send them my way. We'll make sure that we get them taken care of. And that I did that with, I think it was Lockheed Martin, when they, because there's some that do qualify for benefits and some that don't. And I don't really understand the reason behind it. But if you can get in on that HR person, that'll really help you out with those T65s, because they got people retiring every other day, it seems like. So keep that in mind as well.
So I think this is really just a refresher that there's lots of different ways to generate business outside of Medicare Advantage OEP and the annual election period. And you can pick your poison. I would recommend, the newer you are, I love going ahead and targeting that extra help in lower population with something like a direct mail lead. I think that's a really good way to sell year round. That's going to give you a little bit lower cost per acquisition of customers. With that being said, what else are you focused on during, after OEP, but before AEP? Are you, of course you're still working, but are you looking ahead to AEP and going ahead and preparing for that? Or are you looking back on OEP and sending out lots of, cards and birthday letters to your new customers? Like, what are you kind of focused on during that time?
Great question. All the above. I've got a couple of things written down here that I'm currently doing. First things first, I'm the worst at organization, so I'm cleaning up my CRM. And what I mean by that is I'm adding people in, I'm taking people out that have canceled, passed away, whatever the situation may be, moved. So I'm really spending some time cleaning up that CRM. I am sending out a letter here, or a little postcard here, the next few days, that wanted to thank people for an OEP. I wanted to thank people for their loyalty and things like that. I want to send another card. I know I just sent one out last month, I believe, middle of last month. But guys, I think I got 13 new to Medicare referrals off that card, which is huge. I think we spent $300 on that. So I want to send out another one. And I'm not sending one out every month or so. I am sending them out, trying to quarterly, but I think especially after this time, there was a lot of confusion. One of their friends may have switched, and there's another special election period that they can use to get out of whatever they switched with. So they're going to think of you, things like that. So I'm cleaning up CRM. I'm going to send out another postcard here. But guys, I know we talk a lot about special election periods and when to utilize them and things like that. There are going to come situations and times where you don't have a special election period to move somebody. So that gives you that opportunity to just let them know, hey, unfortunately, I can't handle you. I can't do anything with you right now. We are going to be stuck in this plan for the rest of the year. The good news is, however, I will be back in October. Kenny, you really did a good job at that last year, where you had this stack of people to go see as soon as the AEP came around. And so when it finally hit, I mean, you had 50 policies by the first week without calling a single new lead. So you could really be building that AEP book. And it's also a good time to ask for referrals. Both anybody that you wrote in AEP and OEP, like, as long as they're a month out from their effective date and things have been going well, it's a good time to check in on them, make sure everything's working, make sure they've used their over-the-counter benefits. And don't forget, hey, John, if there's anybody that that needs my help, don't forget to mention me. I'm here to help anybody and everybody all over the state of Texas. Another opportunity there.
Man, that's a great point that you just made, that there's a lot of people you're going to meet throughout the course of the year that for one reason or another, they either don't have an SEP, they already used it, or just some scenario why they can't make a change today, but it's obvious that they're going to want to make a change as soon as they can. And all that is just another notch, like another tick mark that of a relationship you've already built, a door you've already opened, that you're going to go back and visit with during that next available time, which is usually in October when the annual election period hits. So make sure you guys are doing that. Don't be discouraged if you run a couple of appointments and not everybody there can make the change that they want to make that day. That is just going to help attribute to a big AEP for you. But also, like you said, Ethan, the more you can stay in front of your customers and stay in touch with them, it's going to generate more referrals. And it's going to remind them that if they run into any issues or they want to make a change, you're the guy to help them do that. So I'm really big on sending out multiple postcards and making multiple touches via, like, say, phone calls before AEP, so that there is no doubt in their mind that they have a loyal agent that is here and ready to help them, to answer their questions, that they, you know, that we are independent agents and that we do handle all of the different Medicare Advantage plans in their area. That if there's a plan that sounds new and it sounds really shiny and good to them, we've educated them that we can help them with all of those different plans and options so that they don't go to somebody else. So I'm spending a lot of time doing that as well, you know, this time of year before AEP.
Super important. I mean, there's some clients that I haven't seen in 2 years for whatever reason. So it's not that they want to switch or anything other than, I mean, you just got to remind them that you are their agent, you are still around, because guys, fact of the matter is a lot of people fail out in this business. So it's important for them to see that you're still here, that you're still willing to take care of them, and that you want to talk about any and all plans with them if that's what they so choose to do. So stay in front of them as much as possible.
So, man, I was gonna start asking you questions on preparing for AEP, but I realized that's a whole nother video.
Yeah,
so let's just
long.
kind of cap it at this. I think this is just a reminder of what we kind of did during OEP, and then what we're doing, that you don't have to quit now that we're out of it. Do a lot of retention, a lot of customer service, and we can pick one of these strategies to continue getting in front of customers until AEP rolls around, right? So if you guys have any questions, please feel free to reach out to us. You can comment below, go to our website, MedicareMillennials.com. Give us a follow on Instagram. It's just at Medicare Millennials. Ethan does a lot of short, bite-sized content on there, and I hope this is helpful for you guys. Ethan, do you want to leave them with any thoughts on this, or?
I think you've covered it all, my man.
All right, my man.
I'll leave it be.
All right, I appreciate it. We'll talk to you later.
See you, bud.